right, thank you for tuning in today. I have with me Mark Robinson with Livingston County Catholic Charities. Welcome, Mark.
Hi, thank you for having me.
Well, we're really excited to have you here today because I know Livingston County Catholic Charities does some amazing things. You've been a member of the Chamber for many years, and you guys are involved in several of our event committees, but you're also doing some great work of your own. Before we jump into that, I'd actually like to have you start by just telling me a little bit about yourself and, what drew you to Livingston County Catholic Charities, and I'll let you kind of take it from there.
Well, I've been at the agency now 20 years. Last week actually was my 20th anniversary.
Congratulations!
Thank you. I originally am a Detroiter, and before coming to Livingston County, I was the director of the Catholic Agency in Monroe for 8 years. I have spent most of my career working for Catholic social work, social service organizations. And I do have a career that actually goes back to when I was a college freshman and working at a parish in inner city Detroit. So I've done a lot of things, but being a social worker, it's been a good place for me to be.
Wow, that's amazing. So you've almost got 3 decades plus.
Working on it. But again, my career started as a college freshman. So,
okay.
I'm married, and my wife and I have one daughter who is rapidly approaching 30, and she's a school teacher.
Awesome. So what drew you to Livingston County?
Well, actually, at the time, I was looking for a new position, for a new challenge, and I knew the director of Catholic Charities who worked for the Lansing Diocese, and our local agency was needing a director at that time, so he kind of conned me into coming. and I didn't live too far away. I lived in Novi, and actually I still live in Novi because my wife spent her career working in Detroit. So we've always shared the travel distance.
That's always nice. I understand that commute.
And actually, I have the easier commute.
I bet because you're going the opposite way.
She was driving, not quite, but close to into downtown Detroit.
Yeah, and no matter where you live, I feel like geographically it's always a challenge to get to downtown. I did that drive for a few years before, things even started coming back, and it was just, it's a mess. So I feel her pain.
Yeah, it is. She retired 3 years ago and was so happy to give up that drive.
I bet. Well, wonderful. Thanks for sharing a little bit about yourself. It's always great to learn a little bit about who's behind the organization. And I know from my perspective as well, it's so funny. What drew me to Howell was looking for more challenges. And boy, we've had our fair share of challenges in this past year, right?
Yeah. Well, and I do believe that if we want challenges, we can always find them.
We can. Yes.
Yeah. So people have said, well, why'd you stay 20 years? Because a lot of people move around in their careers more. And every few years, we added a new program. We created our own challenges. We looked for something new and exciting to do.
Yes, and well, speaking of programs, I know you guys offer a lot of them. So I'm going to jump in here to talking about a little bit about who you serve.
Well, we serve everyone.
Okay.
We are a county-based organization, so 98% of the people we serve either live or work in Livingston County. So very, very minimal service of non-county folks. We, in a typical year, about 30% of the people we serve identify as Catholic. The other 70%, it's a mix of people with other faith backgrounds or no faith background. So we really do serve everyone. We serve all income levels, but in a typical year, 2/3 of the people we serve live below 150% of the poverty level. So if you've heard the United Way term, ALICE, Asset Limited, that's the largest group of people we serve are those who work, they are employed, but they struggle.
Well, we are incredibly grateful to have you in our area because the need is there. We all know that. So you guys were founded in 1985.
Yes.
And with 2 programs. Can you tell me about those 2 programs?
Sure. We started with counseling and quickly added our volunteer caregiver program. And so we've always provided counseling, and we have always provided senior services. Our outpatient counseling includes both on the mental health side and on the substance abuse side. When we originally started, it was more working with families, family relationships, and over time we have greatly expanded. We started doing substance abuse counseling. I think that was the first expansion we did after I came on board. So about 17, 18 years ago, we added that component. And we serve people who do not have insurance. We serve people who have insurance. So we're on many panels such as Blue Cross. And on the substance abuse side, we have several government contracts to work with people who are uninsured. And so it really is kind of a mixed bag. Our senior programs, that volunteer caregiver program was the first, where we recruit, train, do background checks of people who would like to volunteer to assist seniors. And it's mostly low income and homebound or socially, geographically isolated seniors. And so we have volunteers who will drive seniors to doctor appointments or do their grocery shopping, friendly visitors. We've had to modify some of those services because of COVID. Mm-hmm. So we don't have very many volunteers going into seniors' homes today. We look forward to being able to do more of that in the future. But if somebody needs the transportation, we still drive them to the doctor. You know, everybody masks up and cleans out the car and everything. Yeah. So it's still very much a priority. And then since then, we've expanded our senior services. Our first expansion, and was before I came, was what we now call Community Liaison Program. And that's assisting, again, primarily low or marginal income level seniors to find resources so that they can continue to live independently. We have 2 staff who will help seniors fill out those 20-page documents to see if they qualify for a particular government program. They will sit.
So just real quick, so when you say government program, is that when they apply to have a community liaison? Do they have to apply for that, or am I not understanding?
No. We serve people who are 60 and county residents. Okay. That's the only requirement. If we're busy, if we have a wait list, then low income becomes a priority.
Okay.
But other ways we serve people at all income levels. It's just that many seniors, if somebody says to them, oh, you need housing assistance, here's this 20-page form, or here's this online form.
They don't even know where to start.
No.
Yeah, I can imagine that would be incredibly overwhelming.
Yeah. So,
and with all of the scam things out there today, it's nice to have that advocate. Yes. And somebody you can trust.
Yes. So we do a lot of that type of thing. We also have our adult day program, which we started now about 12 years ago, I think. And that is a dementia-specific program. So if you had a grandparent living with you who had dementia and you wanted them to be able to participate in social recreational activities during the day when you went to work, or just to take a break, they could come and spend the day with us. We're open 8 to 6, Monday through Friday. We've had to downsize a little bit currently because of the COVID precautions. So we're serving at less than full capacity today to allow for social distancing. And we're anxious to get back to full operations. But we
so is that like a free service? Or?
No, it's we get 2 different government grants for it.
Okay.
One from what's called the Area Agency on Aging, and they have a mix of state and federal dollars. And then the county, Livingston County government, provides us a grant each year to help with that. The people who attend pay on a sliding scale basis. Low-income people pay as little as $2 an hour. High-income people who don't need subsidy, well, I think it's currently about $18 an hour. most of our people are paying $6, $7, $8 an hour, and so the government funding becomes a subsidy.
Well, and when you have an opportunity for that grandparent or that individual to get out and have some sort of social or recreational activity, I really don't think you can put a price tag on that, but that's my personal opinion. That's amazing.
and the people who come feel the same way. And I do want to also mention that the Livingston County United Way provides us a little bit of funding for that program, and we receive some funding from the Catholic Diocese of Lansing to help support that, along with a number of our other services. So we really do have a diverse budget to make things work.
Well, and that's just, I love hearing that amazing collaboration to just kind of, for the greater good. It's so wonderful. So I know we're going to already be running short on time here, and I honestly feel like I could talk to you all day because some of these programs are so incredibly interesting, and you're very easy to talk to.
Oh, thank you.
Very engaging. But I did want to mention that you're now offering over 12 programs, which is just remarkable. And we could probably find more information about these programs on your website.
Yes, www.livingstonCatholicCharities.org.
Okay.
And our phone is 517-545-5944.
Okay, awesome. Thank you so much for sharing that. I do want to mention too that you guys offer free educational opportunities to the public on a variety of topics through your specialist. And could you just touch on what some of those are real quick?
Sure. Those senior outreach staff provide workshops on Medicare enrollment, on elder abuse prevention. So one of the things we've learned is that financial exploitation is rising rapidly, and you mentioned scams earlier, and so we see a lot of that and how to help people avoid that. Our family therapists will give talks on bullying, especially the internet bullying is a big problem.
It's just
nowadays.
You just can't escape it.
Yeah, and then also related to substance abuse prevention. That's a big area for our staff as well.
Okay. Well, that's great to know. I know that we were able to partner with the Livingston County Catholic Charities on a Medicare program. So that was great during open enrollment, especially because they didn't have all the criteria out yet. And I know there's a lot of confusion around it. So we were happy to do that. And the Chamber's always happy to continue to support the different initiatives as well, because we're in it for the greater good and the collaboration and doing anything that we can do to make Livingston County a better place to live, work, and for our residents and community and businesses as well.
Right.
We have about 30 seconds left. Is there anything else that you wanted to share today?
Well, I think it's just important to know that we really see ourselves as belonging to this community. This community supports us, whether it's through tax dollars donated to the United Way, or through their church, variety of ways, that we believe it's important that we be responsive to the greater good.
Awesome. Thank you so much, Mark. This was awesome. I hope that our listeners enjoyed. I know they will. We'll talk to you soon.
Thank you.